everybody. I'm Gergő Lóránt, and I'd like to talk to you about the border territory, which is the significance of studying the autonomous nervous system in the case of tumors. And I'd like to focus partly on our own research just to show you what opportunities we have available in this topic. As an introduction, the autonomous nervous system, the significance of the homeostasis, and the organizational unity has very great importance in the sympathetic and parasympathetic nervous system, and it is due to that as we know from the descriptions in the literature. It is rather hard to say that how everyone perceives an image, but as for what image we perceive of a tumor and how we should examine it determines our research, namely what we would like to prove and what we believe is worth examining based upon all that. Very briefly, I'd like to touch upon the stress reaction. A patient experiences stress, or a human system experiences stress, if I may put it that way. Then we have based upon the Shea adaptation, there is an alarmatory response first, and then an active resistance when the system is capable of maintaining an adequate homeostasis, and after fatigue kicks in, there's a long-term active resistance. And our hypothesis is that this fatigue comes up with a decrease in adaptation, and this can lead to a disease. Basically, stress can lead to disease. Everyone has heard this commonplace, but in order to provide a scientific background for that, we thought that we could put the scientific background behind it, namely that stress as a physiological change, as an external impact disturbing physiology, which sparks a response, and we wish to find out how that leads to a disease. I don't wish to go into the details of the autonomous nervous system. Obviously, everybody knows more or less that it has a very important role in maintaining the homeostasis in the operation of the entire body and maintaining health. However, the autonomous nervous system was why it's difficult or impossible indeed to measure it. The operation of the autonomous nervous system, based upon simple physiological observations like the various stimulus, changes in blood pressure or sweating, and the changing in blood pressure might have been measured, but nothing else could have figures added to it. And in the 80s and 90s, the heart rate variability appeared that we use in order to provide figures for this. We have a program which can show some 40 variables individually based upon what values are recorded in the case of a patient after a given measurement by the sympathetic and parasympathetic nervous system in proportion and separately as well. The value can be imagined in a rather simple manner. The heart rate variability is measured in a way, but this is the simplest way. The variability between the RR distances are described, and with a Fourier transformation, which is a mathematical formula, which is not only used by us, but also all the smartwatches, which are probably found in this room, worn by you. All these use this transformation, and that provides us, or that makes the watch tell you what stress you experience during the course of the day. Obviously, you might ask the question, in the case of what pulse this counts, because the frequency might be 80 in the case of some, 120 in the case of others. Variability is the key here. If you analyze an ECG, then you can see that there are 0.8 seconds between every R waves on an ECG. This 0.8 are values in the case of digital ECGs. And the main essence is that if there are continuously different values, and that is variability, during the course of autonomous nervous system examinations, the narrowing of this variability, when the RR distances are 0.8 and 0.0 after each other, then that's an autonomous narrowing, and it means the decrease of the autonomous nervous system. And now very briefly, for many years, we have known that there are very important participants of the system with this hypothesis, which are the most important controllers. I'm talking about the vagus system, obviously, which we measure. And then what do we use it for? Later I will show you what functions of the vagus we measure, with which we can measure the culinary inflammatory route, which is very important in our topic. And we can state what impact are given to the heart by the various fibers. We started out from the following. In an article we saw involving multiple patients, that the autonomous dysfunction was current in the case of 80% of patients suffering from a tumor, cancer patients, and there were other data available which shared even higher figures than that. Our research started out partly from that, and together with another very interesting article, and quite interestingly, after it turned out that the autoimmune system can be measured like that, we searched where we could use that in oncology. And allow me also to add that we have enormous amount of data available, which we do not always have access to. We can measure autonomous nervous system functions. Apple and Samsung watches are capable of ECG performance approved by the FDA, and millions of data are pouring in, which are then analyzed. And they can not only prognose a heart attack based on the digital ECG data, but also stressing or stressor and other values indicating to the patient or the user, if they are not a patient yet in the system, what they can expect. In the supply chain, I also mentioned what opportunities we have, where we could use the autonomous nervous system and how we could correlate that, or with what we could correlate that. And we decided or opted for prognosis, but the other steps are also in progress. So it's as prognosis that we primarily wish to forecast with the autonomous nervous system function. And after we have performed our measurements, we will do a follow-up activity regarding the patient. And later our plan will be, and this is actually partly under permission or gaining permission, providing smartwatches to the patients. We would monitor them constantly. The research of the past 50 years always to the following course, whatever research we're talking about, is that there were given days when blood samples were taken from the patient or a control examination performed, and as opposed to that, we would have continuous monitoring available. So obviously we examined the relevance as well. We were waiting for the permissions, and the way we established our research is that during the course of the chemotherapy of the patients, we perform the measurement we did 5 minutes measurements because if we have short-term measurements and not 24-hour measurements, the 5 minutes was what they used in the most examinations. We use a Finnish program called Kubios, through which we analyze the functions through the heart rate variability, which provides some 40 values for the autonomous nervous system functions, dividing it into parasympathetic and sympathetic nervous system functions. And we collect these values. They are currently under analysis. And later our plan will be to cooperate with others. We have made such attempts that if the autonomous nervous system functions have such good results for patient prognosis, then we will have opportunity for neuroimmune modulation through the stimulation of the vagus nerve, and through that stimulation we can improve the health of patients. Very briefly, I will now share with you the theoretical background of the anti-inflammatory pathways. Then the main essence of an anti-inflammatory pathway is that there are two pathways where the brain is connected to the area of inflammation, which means that a quick efferent mechanism is established through various cytokines and through the hypothalamus and hypophysis and the traditional stress hormones is implemented. And the culinary inflammatory pathways examination, namely that this takes place in the vagus, and if we have the opportunity to determine how that takes place. In the case of research, animal research, it was found that the vagus nerve is made up of A, B, and C parts, and various responses are received for various stimuli, and it has been examined that with a 1 volt 5 hertz 1.5 second stimulus, this culinary inflammatory pathway, which has an inflammation inhibitory factor and a tumor inhibitory factor, whereas it has no impact on the heart. And now just a few more thoughts. How this culinary anti-inflammatory pathway establishes its tumor inhibiting function. Tied in with the acetylene receptors, it is anti-inflammatory and releases tumor growth inhibiting cytokines. And it has been shown that in the spleen, the myeloid-based suppressor cells, MDSC cells, in other words, are inhibited by this mechanism. And the role of these, that it inhibits the lymphocytes, but in this way they cannot be inhibited, and a much stronger immune response, a tumor-destructive immunoreaction is brought about.
Well, just very shortly, the neuroimmunomodulation I would like to discuss. This was discussed previously before this pathway was known, that the vagus activation leads to antioxidative stress and it decreases sympathetic activity. And the presence of this are closely associated with tumors. In the year 2000, the hallmarks of cancer, there's information was published, and these 6 mechanisms or characteristics were published. Then this was not yet included, but in the 2011 version, the metabolic reprogramming, or beyond that, the significance of inflammation was also added. So there are 14 hallmarks of tumors. One of them is inflammation and the inflammation environment, the maintenance, and the decrease of that to allow a greater access for chemotherapy agents, which would make future progress. What future possibilities exist, what opportunities we have in modulating the autonomous nervous system and tap into the patients. This goes down to translational medicine and the issues of digitization and how this will trickle down through healthcare to the patients. In the United States and in other countries with better financing, you can also apply, uh, ascribe digital ailments. You can write a prescription for digital applications and smart watches. The patient can use this by request of the physician. And this whole application, what I've said, the continuous monitoring of the autonomous nervous system would also be important in monitoring, following up patient, and also in primary and secondary prevention, based on the fact that the function of the autonomous nervous system function correlates with the patient's status. We also measure the autonomous nervous system function by the ECOG status, which is taken as a part of patient history, and we correlate this with other findings. And in the future, we hope that these autonomous nervous system functions will be used in patient treatment, not only in the field of oncology in our own hospital and in our hospital. There's a research underway. We're looking for permissions at this point that we would not only involve oncological patients, but all patients at our hospital to see the outcomes of surgical stress to the healing and outcome progression of patients, and what adaptation the patient shows through the autonomous nervous system, for example, in their circulatory system, together with specific values. If one can predict a patient outcome, and one can make a prediction to the adaptation status of patients, this would impact the therapy and the outcome of the patient itself. For example, those who have tried to place a patient in intensive care, they know that the intensive care physicians are hard to find cooperation, because if the patient does not require intensive treatment, then they shake you off. I don't want to offend these physicians, obviously, but patients with certain characteristics that not only come from drawing of blood, but shows the complete adaptation spectrum of the patients. You can make these decisions much easier. I just give you a few examples for innovations and smart devices that are already allowed for clinical use in telemedicine abroad, and these are also used in physicians' visits. gadgets that also measure autonomous nervous system functions via smartphones that communicate with smartwatches and provide this data to the data, and this could lead to monitoring in intensive care, and patients can follow such a path based on these devices in the United States. And with very simple devices such as just stickers or digital tattoos placed on patients, you can monitor these autonomous nervous system functions, and even the patient's perspiration and sweating and similar factors can also be quantified and used for the continuous monitoring of the autonomous nervous system function. There are a few other questions we'd like to examine. Whether the HRV results characterize the patient's autonomous IR for one moment only, or can we use it for further prognosis? A 5-minute measurement may not be enough to decide, but there are already recommendations, values in place that have been found that correlate well with the long-term survival of patients. So it shows a greater patient adaptation, just like the fuel consumption of a car. The speed, so to speak, of the patient provides an estimate on how long they'll live. We try to differentiate in the field of oncology whether the presence of the tumor generates change, which is why this value is different in cancerous patients, or is it the fact that the patients have a predisposition, that the adaptation of the patient is different, which will then shape their future once they get cancer? In one case, this is a diagnostic marker, in the other case, this is a therapeutic opportunity, and we'd also like to expand autonomous nervous system function to other areas outside of oncology, and I trust that in the future maybe we can even change and modulate the function of autonomous nervous system and the fate of patients. Thank you very much indeed for your attention.